name is Chandra. I've been working in the health facilities for more than 25 years, and for the past 4 years I've been suffering from back problems, and I have gone to all the doctors within Winnipeg, the neurosurgeon, you name it, and they all told me they can't do anything about it. I'm supposed to live with that pain, and I am suffering for, like I said, for 4 years, and I've been having tremendous pain, crying every day, couldn't get up, couldn't walk, couldn't stand, couldn't do a thing, and they couldn't do a thing about it. So a friend told us about this thing in Chennai, and we decided that we should take this route. And right now, this is where I am in Chennai, and I had the surgery, and I'm very much pleased. Things I couldn't do before, I can do, and this is just a matter of 2 weeks or going into 3 weeks so far, and I think I did the best thing by taking this step.
Well, my wife worked 25 years at the St. Boniface Hospital in Winnipeg, and for 4 years now she's had tremendous spine pain, and at times when I came home she was rolled up in a ball with such pain. And when we went to the doctor, actually several doctors in Winnipeg, to try and get it corrected, they said that they couldn't really correct it. They were uncomfortable doing the surgery. So the family doctor actually had set up to send us to Toronto, but supposedly he was too booked to take us. So at this point in time, after 4 years of a lot of pain and agony, we were getting very fed up with the system, and we had some friends suggest to us that maybe we should look into Tourism Surgical Canada. And we did that, and researched at a world-renowned spine surgeon here in India. And since the doctors at home thought they couldn't do the surgery or weren't willing to do it, we came all the way out here to have it done. And so far it looks as if it's going to work very well for us. So we're very happy with the outcome of the surgery to date. When I look at the medical system in Canada and I see the millions of dollars that we're spending into our medical system, and when I'm looking at what we're getting back on all that money spent, there is something very, very wrong with our system. When you look at the taxes that you're paying and the dollars that are going into medical, and then you look at the system that we have and how hard it is to get in to get something done, the protocol that you have to go through, and in some cases when you have an older clientele, or however you would put that, they're very quick to push you aside and maybe just kind of wait for it to go away on its own. But I think it's a real injustice to the people of Canada when they pay such tremendous amount of money to supposedly have the best medical system in the world. When you really find out the truth and the reality of it, it's a system that's broke and needs a lot of fixing, and that goes all the way through the system, not just, I think it starts in Ottawa and comes all the way back to the doctors and so forth. The whole system needs to be revamped and rethought, and we need some serious help to get that back on its feet. I went and got a physical for myself in Chennai here, just to because I just was concerned at my age. I'm 57 years old. I just thought that it was time to have a complete physical done, and I was surprised at how thorough the physical was. And it only took about 2.5 to 3 hours to do. They did everything on me. They did the chest x-rays, they did the EKG of the heart, ultrasound, I had my kidneys checked, I had the heart measurement, I mean, and it was so very, very thorough. I had the urine, the blood analysis, stool, I mean, the whole ball of wax was done. And the amazing thing for that whole test and all the documentations that I received was detailing every part of my body. And when they were said and done, it cost me 2,600 rupees, which was about 70 Canadian dollars. So I have never ever received such a thorough investigation of my body in Canada ever. So you know what, I take my hat off to these people in India. They're doing a much better job than what we seem to be doing with the public system. And we're always saying, you know, preventive medicine, you know, you should go see your doctor, you should go do this, you know, if we can catch it early, especially when in terms of cancer, heart disease, and so forth. Well, you know what? With our system there, we're never going to catch it early, my friends. We need to do that by changing the system, because right now it is so broken that we can't go in there to get a good health check in our part of the world.